So we're here today with Ritika, our occupational therapist at Reach Behavior Development Center and one of my favorite people in the world.
Oh, hi, Mana.
Hi, Ritika. Okay, so Ritika, why don't you tell me a little bit about your background?
Okay, so I did my bachelor's in occupational therapy. It was a 5-year program, and then later I did my post graduation in pediatrics. So in occupational therapy, there are different variations to do your post graduation. I opt out pediatrics, and that master's was a 2-year program. In that, I did a dissertation, and the topic for the dissertation was tactile defensiveness in autism. And then I have years of experience in both clinical and school setting.
Oh, fantastic. Wonderful, wonderful. So tell me, Ritika, what comes under the umbrella of occupational therapy?
Okay, so basically, occupational therapist deals with both pediatric settings and adults population. In pediatric, it comes with sensory system, motor system. In motor system, it comes with fine motor skills or gross motor skills. And gross motor skills are further related to play skills. And then comes is the cognition and perception, which are related for free-writing and handwriting skills. And under to cognition and perception, one more thing is there. It's the executive functioning, which is the highest system of our brain. And in that, all motor planning, organization, time management, everything goes under to that. And then comes the daily living skills like the self-care tasks, grooming, dressing, bathing, all come under that.
Okay, fantastic. So tell me, what's the difference between occupational therapy and physical therapy?
So if I'll start with occupational therapy, so occupational therapist basically deals with all the daily living tasks for a pediatric population.
Right.
And for kids, if you think about what are their daily living tasks, is like the play, leisure, academics, doing self-care tasks, all comes under OT components. And if I'll talk about physiotherapist, so physiotherapist basically works with mobility and movement.
Right.
But the topmost component, what OTs are leading for, is like the sensory integration approach, which they are professionally trained to do that.
Fantastic. So tell me, how can occupational therapy help a child?
Okay, so as I discussed about the components for occupational therapy, what all systems comes under the occupational therapy. So basically, if I'll say a child comes in, a parent comes in and they say, oh, my child shows a big tantrum while doing hair cutting or while doing nail cutting.
Sure.
So then occupational therapist works on one of the system of sensory system which has tactile input. Occupational therapist works on the tactile system to desensitize that area, and then later on the child will be okay with all the textures, even while eating food and everything, because all the things are related to our body, and then comes the oromotor structure.
Okay, fantastic. So can you tell me maybe an example of a child that you've worked with where you found that it was kind of like a success story? They started occupational therapy and they did really, really well.
Okay. So as I told, that occupational therapist works with cognition perception, and in that comes free-writing and writing skills. So I'll share that instance for handwriting.
Okay.
Like a lot of parents complain that my child doesn't have a good handwriting and child feels fatigue while writing. So it's just not the handwriting. All the major components are related with that. Supposedly pencil grip, your core strength, your upper extremity strength, all of these things are related for handwriting. Even motor planning, because some kids struggle while copying from the blackboard and they skip lines in between. That's why because it comes with the executive functioning, that's why the problem comes in. And then occupational therapist intervene in that area.
Okay, great. So you've helped a lot of kids with handwriting
Yes.
and improving their handwriting skills.
Yes, even with the sensory system.
Beautiful. What about the parents who come to you and say, our children will just grow out of it. They don't need occupational therapy. They're just going to kind of grow out of it on their own. What would you say to those parents?
Yeah, I heard a lot of times, like people say, even for the speech therapy, they say, yeah, right now my child is not talking, but later on they will. But what my experience suggests is like the early to start with the intervention is the best therapy, because if I'll talk about just the sensory system, if the child will grow with that sensory issues, it will going to disturb the child and give them a lot of negative effects. So, and the child will be burdened with all of the sensory issues what the child is having. So it's better to focus on the early intervention and rule out that portion and then work for other areas.
Right. All right. So if somebody wanted to start with you, what would be the process?
Okay, so supposingly a parent's call at reach, and then the office administration, she will take up the concerns from the parents, and then she will say, okay, we'll get back to you. And the consultation is like, the first consultation is the free consultation. And when the parent comes in, so for supposingly they ask for an OT or whatever their concerns are, I will sit with the parent and I will tell them, okay, I will ask them what are your concerns, and then we will later come up with a screening protocol in which the child comes in, I will observe the child, screen the child, and then later on we'll give them a report in which we will talk with the parent, discussing about what all areas I'll be taking care of their child to show the improvement. And then after every 2 months, we are doing a progress report just to tell them or just to show them from where we started until where we reach.
Okay, fantastic. All right, thank you so much, Pratika, for taking the time to speak with me today.
Thank you, Mona.
Thanks.